This is our terminology section of chapter 2, beginning on page 59. We have the combining form of abdomino. This means abdomen. Our medical term is abdominal, and this means pertaining to the abdomen. Next, antero means front. The medical term anterior. The suffix ior means pertaining to. So anterior is pertaining to the front. And it tells us Table 2.1 has additional useful positional and directional terms. So this table is shown on our next page, I believe, page 60 at the top. So we have position, directions, descriptions, and examples. Anterior, the front side. The nose is on the anterior of the head. Posterior is the back side. The heel is on the posterior of the foot. Inferior is below. The feet are inferior to the knees. Superior is above. The head is superior to the neck. Then we have lateral, which is the side. The ears are lateral to the mouth. Medial is middle. The heart is in the medial area of the chest. This is why it is referred to as the mediastinum. Distal is far. The distal end of the thigh bone, which is the femur, is at the knee. And proximal is near. The proximal end of the thigh bone is at the hip. Deep is away from the surface. The stab wound penetrated deep into the abdomen. Superficial is on the surface. Superficial veins can be seen on the surface of the skin. Supine is facing up. The patient lies supine during an examination of the abdomen. And prone is facing down. The backbones are examined with the patient in a prone position. All right, our next combining form is broncho. And this means the bronchial tubes leading from the windpipe to the lung. And our medical term is bronchoscopy. This is a visual examination of the bronchial tubes. Remember to break your word down into the root and suffixes and prefixes to determine your meanings. Our next combining term is cervico, and this is the neck of the body or the neck cervix of the uterus. So we have cervical. This is pertaining to the neck of the body or pertaining to the cervix of the uterus. You must decide from the context of what you are reading whether cervical means pertaining to the neck of the body or pertaining to the uterine cervix, which is the lower portion of the uterus. So figure 2.11, we have the uterus and cervix. The cervix is the lower portion of the uterus opening to the vagina. Our next combining term, we have chondro, and this is cartilage, the connective tissue attached to bones. So chondroma, this is a benign tumor of cartilage. And then we have chondrosarcoma. This is a malignant tumor of cartilage. The root sarc, meaning flesh, indicates that the malignant tumor arises from a type of flesh or connective tissue. Then we have the combining form of coccygeal, and this is the coccyx or tailbone. Our medical term, we have coccygeal. The eel means pertaining to. So coccygeal is pertaining to the tailbone or coccyx. Next we have cranio, which means skull. So our term craniotomy, incision of the skull. Next we have epithelio, which means skin or surface tissue. So epithelial is pertaining to skin cells. The term epithelial was first used to describe the surface, epi meaning upon, of the breast nipple. Thelio actually means nipple. More correctly, it describes the cells on the outer layer or surface of the skin, as well as the cells that line internal organs that lead to the outside of the body. Our next combining term we have esophago, meaning esophagus. This is the tube from the throat to the stomach. So esophageal means pertaining to the esophagus. Then we have hepato, meaning liver. So hepatitis, we know, means inflammation of the liver. Then laparo, we know, means abdomen. So laparoscopy is the visual examination of the abdomen. Next we have laryngo, which means the larynx, and this is the voice box. So laryngeal means pertaining to the larynx. And we also have laryngectomy. This would be excision of the larynx. Our next combining term, latero. This means side. So lateral is pertaining to the side. Lumbo means loin or waist area. So lumbar is pertaining to the loin or waist. A lumbar puncture, also known as a spinal tap, is the placement of a needle in the lumbar region of the spinal cord to inject or withdraw fluid. And we have figure 212 that goes along with that. So a lumbar puncture spinal tap. The patient lies on his side with his knees drawn up to the abdomen and the chin brought down to the chest. This position increases the spaces between the vertebrae. The physician inserts a needle between the third and fourth or the fourth and fifth lumbar vertebrae. And cerebrospinal fluid, known as CSF, is withdrawn, or medication can also be injected. The end of the spinal cord is where the spinal nerves begin to fan out toward the legs. Performing a lumbar puncture below this level avoids injury to the spinal cord. Next we have lympho. This means lymph, and lymph is the clear fluid in tissue spaces and lymph vessels. So our medical term, lymphocyte, white blood cells that fight disease. There are two major types of lymphocytes. You have B cells and T cells. B cells produce disease-fighting proteins called antibodies. Then we have mediastinum, which is the mediastinum, the space between the lungs. So mediastinal is pertaining to the mediastinum. Pelvo means pelvis, the bones of the hip. So pelvic is pertaining to the pelvis. Peritoneo means peritoneum, and this is the membrane surrounding the abdominal organs. So peritoneal is pertaining to the peritoneum. Peritoneal fluid produced by the peritoneum lubricates its surface to prevent friction. With peritoneal inflammation, which is peritonitis, fluid may accumulate in the peritoneal cavity. This accumulation of fluid is called ascites. And this is shown in figure 213 on the top of page 63. We have ascites. Abnormal intraperitoneal fluid can result from conditions such as liver disease, peritonitis, and ovarian cancer. You can see in the right-hand graphic there for figure 213 the buildup of the fluid in the abdominal cavity. All right, next we have pharyngo, which means pharynx or the throat. Pharyngeal is going to be pertaining to the pharynx. The pharynx is the common passageway for food from the mouth and air from the nose. This is shown in figure 214. Notice that the epiglottis, a flap of cartilage, closes over the trachea during swallowing so that the bolus or mass of food travels down the esophagus and not the trachea. It's kind of like a trap door. Tells everything which way to go. Now, your little side note, your mother was right. Don't talk while you're eating. Talking opens the epiglottis so that if you're eating and swallowing while talking, food can accidentally enter the larynx and trachea, causing you to choke. All right, our combining term, we have pleuro, which means pleura. So the medical term pleuritis is inflammation of the pleura. Postero means back or behind. So posterior, pertaining to the back or behind. Radio means X-rays. So radiology is the study of X-rays. This diagnostic medical specialty includes X-ray procedures, ultrasonography, which are images obtained using sound waves, and nuclear medicine, images obtained using radioactive substances. Sacro means sacrum. The sacrum is the 5 fused bones in the lower back. So sacral is pertaining to the sacrum. Be sure not to confuse sacro, which means sacrum, with sarco, meaning flesh, which is used in sarcoma, a malignant tumor of fleshy or connective tissues. Next we have spino, which means the spine or backbone. So spinal, pertaining to the spine. Thoraco is chest. Thoracotomy means incision or cutting into the chest. Thoracic is pertaining to the chest. Next we have tracheo, which means trachea. This is our windpipe. Tracheotomy, incision or cutting into the trachea. And down in figure 215 is an image of a tracheotomy. This procedure may be performed to open the trachea below a blockage from a foreign body or tumor. You can see that purple incision in the trachea. And then lastly, we have vertebro. This means vertebra or backbone. So vertebral is pertaining to the backbone or vertebra.